Being burned alive. Being burned alive is widely considered one of the most agonizing ways to die. When the skin reaches temperatures over 44 degrees Celsius, 111 degrees Fahrenheit, tissue damage begins. At around 60 degrees Celsius, 140 degrees Fahrenheit, human skin is destroyed in less than 5 seconds. The pain is excruciating because the skin is loaded with pain receptors known as nociceptors. In the early stages of a burn, these receptors send overwhelming signals to the brain. As the fire spreads, muscles, tendons, and even bones start to break down. Victims often suffer from inhalation injuries too, scorching their lungs and causing suffocation before their nervous system finally shuts down. The psychological trauma of conscious burning adds another layer to this agony, making it one of the most torturous deaths known to man. Radiation sickness. Acute radiation syndrome, sometimes known as ARS, is not only lethal but also excruciating. An exposure to high doses of radiation, such as that which occurs as a result of nuclear accidents, Chernobyl for example, causes your body to be torn apart at the cellular level. Patients get severe skin burns, vomiting, and diarrhea almost immediately after the incident. During the course of the days, the bone marrow begins to die down, white blood cells begin to go, and internal bleeding starts to occur. There is a possibility of skin flaking off. Ulcers in the mouth can get infectious. The pain becomes persistent and intense, and there is no way to alleviate it in an efficient manner. One of the most painful aspects of this condition is that those who are affected by it frequently maintain their mental alertness for several days, while witnessing their bodies literally deteriorate from the inside out. Drowning. Drowning is not always as peaceful as movies depict. Scientifically, it's a brutal process. When a person is submerged, they instinctively hold their breath. Carbon dioxide levels build up, triggering the painful urge to breathe. Eventually, they gasp for air and inhale water instead. This water floods the lungs, causing a violent spasm of the airway. The feeling is described as burning, tearing, and crushing in the chest. The brain is starved of oxygen, leading to hallucinations, confusion, and panic before consciousness fades. The average time to unconsciousness is about 2 to 3 minutes, but every second is a fight against suffocation and the body's primal need to breathe. Being skinned alive, historically used as a form of torture, being skinned alive is arguably one of the cruelest methods of execution. Skin is the body's largest organ and is filled with sensory nerves. Removing it while the person is still conscious sends waves of unfiltered agony to the brain. Without skin, the body loses its ability to regulate temperature and fight infections. Shock quickly sets in, but not always fast enough to dull the pain. Victims can survive for hours, sometimes even days, fully aware of their injuries. Crucifixion. One of the most historically painful deaths, crucifixion was not about speed, it was about torture. The pain begins when nails or stakes are driven through the wrists and feet, destroying nerves and blood vessels. Once hung, the victim struggles to breathe. The chest collapses, and the only way to inhale is to push up on the nailed feet, reigniting pain every second. Muscles cramp, bones dislocate. Death comes through a combination of shock, asphyxiation, and cardiac arrest, often taking days. The slow suffocation and burning muscle pain make it a top contender for the most excruciating death. Decompression. Explosive decompression in space. Imagine being thrown into space without a suit. Hollywood often gets this wrong. In reality, your blood doesn't boil immediately, but the lack of pressure causes your body to expand, your lungs to rupture, and your blood vessels to burst. Oxygen rapidly leaves the bloodstream, leading to hypoxia within seconds. Before unconsciousness, you're conscious just long enough to feel your skin freeze, your eyes swell, and your lungs collapse. NASA tests show you can remain aware for up to 15 seconds, each second filled with confusion, disorientation, and a crushing sensation in the chest. Organophosphate poisoning. This particular form of chemical poisoning, which is frequently brought on by nerve agents such as sarin gas, interferes with the neurological system in its entirety. When the individual is completely conscious, it causes the muscles to tense in an uncontrollable manner, which results in convulsions, vomiting, paralysis, and asphyxia. The fact that you will no longer have control over your body is what makes this kind of death so terrifying. While their lungs are seizing up, their eyes are burning, and their body are turning on itself, victims frequently maintain their mental alertness. The entire procedure may only take a few minutes, but because of its violent and claustrophobic character, it feels like it has been going on forever. Eaten alive by animals or insects. Whether it's sharks, lions, or ants, being eaten alive is a primal fear, and for good reason. Unlike predators that kill before eating, some animals begin devouring their prey while it's still alive. The pain depends on the type of attack. Large animals cause crushing and tearing pain as bones break and flesh is ripped apart. Swarms of insects, like driver ants, can consume a living person over hours, chewing through flesh bit by bit while pain receptors go into overdrive. Add fear, panic, and helplessness, and the psychological torture matches the physical one, being boiled alive. This medieval method of execution is another level of horror. As the temperature of the water increases, skin begins to redden and blister. At around 70 degrees Celsius, 158 degrees Fahrenheit, nerve endings start to die, but not before sending relentless pain signals. Muscles contract uncontrollably. As the boiling continues, internal organs begin to fail. Death is slow, often taking minutes to hours, depending on whether the person is placed in already boiling water or brought to temperature gradually. It's a blend of physical burning and deep tissue destruction. Electrocution, non-instant. It is not always the case that electrocution at lower volts results in instantaneous death, and that is where the discomfort lies. It is possible for electric shocks to disrupt nerve signals, which can result in the sudden contraction of muscles. When the current travels through the sufferer's muscles and tissues, the victim experiences a sensation that is similar to burning and tearing. The skin can become burned. In particular, the heart is prone to experiencing spasms. Seizures, cardiac arrhythmias, and total nerve overload are the symptoms that victims experience if the current is not powerful enough to induce death immediately. Some forms of torture involve the application of electrocution over a period, which prolongs the victim's anguish and ensures that they remain aware. Rabies, untreated. Rabies is often overlooked, but it's one of the most terrifying and painful deaths. The virus attacks the nervous system, causing inflammation in the brain and spinal cord. Early symptoms seem mild, fever, headaches, but then the neurological symptoms kick in. Victims suffer extreme anxiety, hallucinations, muscle spasms, and one of the most horrific symptoms, hydrophobia, or fear of water. Even the attempt to drink causes excruciating throat spasms. Death from rabies is slow and involves a complete breakdown of the nervous system, while the victim remains fully aware during much of the process. If you found this video fascinating and chilling, give it a thumbs up and subscribe for more deep dives into the extreme side of science and the human experience. Thanks for watching, and stay safe out there.